All right, thank you.
I count.
Next item on the agenda is the approval of minutes. We have 3 months worth of minutes in front of us. We can take them as a group or individually, however you'd like to do it. So we'll entertain a motion or discussion.
I move to accept June, July, and August minutes for the Board of Health.
Second.
We have a motion and a second. Any further,
Oh, yeah.
any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is the board president announcements. I don't really have any announcements other than I was able to attend the Health First Indiana meeting, public outreach that the health department held at La Casa. It was,
Agenda, I'm sorry.
I didn't do that.
No.
I don't remember voting on that.
That is
No.
true.
Sorry, apparently I did not get a motion to approve the agenda. I skipped right over it. So going backwards, everybody has an agenda in front of them. I would entertain a motion to approve the agenda, or
I'll move to approve it.
we have a motion. Do we have a second?
Second.
Motion and a second. Any further discussion? All those in favor, please say aye.
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 Opposed, same sign. Motion carries. My apologies. Moving too fast. Back to my announcement. So I was fortunate enough to be standing room only. The snacks and drinks were great. There's another meeting tomorrow night out in New Carlisle. So at the very least, come and get some good snacks and drinks and give us your input. We're desperate for that, or we very much want it. And then I believe there's another event. I can't remember the date. Dr.
It's on Saturday, the 23rd from 10 to 11 a.m. at the Holiday Inn in Mishawaka.
Holiday Inn in Mishawaka, Saturday, the 23rd. All right, very good. Next item on the agenda, health officer's presentation and report. Dr. Purushottam, I'll turn that over to you.
Thank you. I first wanted to thank the board for allowing me to change or try a different approach for the health officer presentation. So what you should have received is a light packet of summaries from our various unit directors about how we were doing this month, high level communication. And then we will also include and bring back the unit spotlight. And tonight we'll be talking about the environmental team. And then every quarter you will receive that original packet that you're used to having. So this will just give us flexibility in how we present information about what's happening within the health department. So tonight I just kind of wanted to take a minute to talk about some of the highlights in the report that you received, then give you updates regarding Health First Indiana, and then we will move on to a 10 to 15 minute presentation from our environmental team. So I think one of the most interesting things that I noted during the health officer report is just the volume of really good work that the health department is doing. I wanted to just pay attention, oh my gosh, to the number of inspections that we're doing. The food department had a 47.8 increase in food establishment inspections compared to last year for year to date. So over the course of 8 months, they've done 2,250 inspections compared to 1,522 last year, really reflecting the good work that the food inspection team has done now that they're fully trained and their staffing is appropriate. I also wanted to call out the work that have been done by our health officer in the HEED unit. They did the highest number of social needs assessments that they've ever done since the program has begun. In August, they did 110 social needs assessments. And that just kind of speaks to the relationships and partnerships that we are starting to build as we're able to access more people and do these assessments appropriately. And then even our nursing staff with their mobile clinic, They gave a record number of vaccinations from their mobile clinic, 254 shots, more than they did last month. So just kind of highlighting some of the new accomplishments in terms of access that the health department is able to bring. All of the other units are also working incredibly hard and adding significant value to the health of our community. But I just wanted to acknowledge those successes. Are there any questions regarding the report before I move on to some updates regarding Health First Indiana?
Any questions from the board members?
Okay.
Comments?
I know it's not specifically in the report, but could you give us some feedback from your perspective on how the last community meeting at La Casa went? Because I was there too, and I thought it was great. And a shout out to Robin for putting together a very, very nice program. But if I just wanted to give you a chance to speak a little bit on that.
Yep. So one of the goals with the Health First Indiana is to have listening tours, and La Casa was our first one. It was well attended. Our unit directors had an opportunity to come together and discuss some of the feedback and conversations that we had. And it was really good to hear about what our community thinks we're doing well and some areas that they think we need to improve on. Maternal health was an issue, questions about how we provide access to those who have less access and what we plan on doing with our funding and distribution. Those came up a lot. We also have a REDCap survey, which is a way for us to gather further information from those that are not able to be present. And as of yesterday, we had 279 responses, just kind of highlighting the engagement we're able to capture with the community. And then we have those 2 events that are also coming up. But it's really been nice. It seems like people are happy that we're here. They're excited about the work that we can do, and they want to be engaged. So thank you for the question.
Is that survey available online if somebody went online? No.
No, it's an internal survey right now. We're keeping it open. Some of the major questions that it's asking is, how have you interacted with the health department? Which service lines or units are you working with? What do you think you need? And then we have a comment section, a free section where people have been able to express their opinions on the health department in general and things that they think we need to improve on. Something else that we've been able to capture with that are people who are interested in partnering with us with the grant money. We've had a couple people share some of their expertise. And so we're keeping a list of those people. So when we talk about how we distribute the funding, we're able to provide access to those that have communicated interest.
Great.
One more question. So the REDCap survey is, I guess I just need some clarity. Is that different from the public survey that
So
you're
it's
making available?
So this is a survey that we're offering all of the public to take.
Okay.
And then the results are being reviewed internally to help direct where and what and how we do things.
Okay. And but you're also reaching out to community partners separately and kind of a separate, is there a separate survey for community partners, or is it just?
It's
Okay.
just one survey for everybody. But
Okay.
as I'm trying to meet and introduce myself to the community, I do talk to a variety of community partners. They're also aware about this funding. So
Okay.
it's been a good discussion all around.
Just for clarification, the survey that you're using is also called a REDCap survey. Is that correct?
Yes.
Yeah, I think that was the
Oh,
confusion.
yeah. It's one survey. We're doing only one survey.
Okay.
All right.
So you said you had 279 responses so far?
Yes.
Okay. Great.
So if other members of the public wanted to take the survey,
Yep.
can they do that online, or do
Mhm.
they have to come to an event?
So whichever way they want to reach us, if they go to an event, we have surveys available there. We've been passing around these flyers. They have information and a QR code that links to our website and to the survey as well. And then if you just log on to our website, this flyer is available, and there's also a survey there too. So multiple ways.
Great. Would you mind, I think I asked this last month, just what's in your mind as far as schedule, as far as the Health First
So
program.
maybe I can just start talking about where we are with the Health First in terms of, is that what you were talking about? How much money, how we're gonna distribute and what we're doing with it?
Just, yeah,
or-
their schedule, what the program, is gonna look like and what. when you're-
So I'll just state that we recently found out how much money we are gonna be awarded. We will be awarded $3,293,255.46 as of January 1st. Right now, we're in the process of reviewing what are the needs of the health department and how that funding can support the health department and what we're currently doing. The state of Indiana is requiring a revised budget that accounts for all of the money that they have allocated to us to be due September 25th. So we're hoping to meet with the finance committee before that, perhaps next week, to just give a rough estimate of how we think the money needs to be distributed. They're comfortable with us just having big buckets of, we think this is how much money we're gonna spend on maternal health. We think this is how much we're gonna spend on chronic conditions. And allow us to kind of lay out the foundation for how the money is going to be distributed within our own budget. So that is the plan for this month. And then once we have confirmed what our budget will look like, our current thought is perhaps opening this up as grants to community partners so that they can apply for grants to access this money. The deadline and the details of that is currently being worked out, but our goal was to have it accomplished in the next month and a half. This month, we have to complete our budget, and then next month being more intentional about the execution so that we're ready in January. And along with that comes, what is the structure of the health department, the personnel that we need to hire to be able to staff this. So lots more information and detail.
Can I ask for a quick clarification on the
Yes.
money? The 3.29 million, it's the first installment. There's potentially other installments. Over what period of time does the 3.29 million?
I think we get one check, right? In January? I'll have
To get
Amy.
a timeline.
Yeah, the $3.2 million is for the calendar year of 2024. For January 1st of 2025, we would have an additional funding amount between $6 million to $8 million. And that number, of course, wouldn't come out until like this time next year.
Thank you
Yeah.
very much.
You're welcome.
Do you have a better sense of what state grants and funding opportunities that we've had in the past will go away under Health First? I know that there are a couple of grants that it sounds like we kind of didn't know whether they were going to continue. Do you have more clarification right now as to which ones are going away because we're in Health First?
The only two state grants that we currently have are the Health Trust Fund as well as the Local Health Services Grant. And those are being absorbed into Health First Indiana. So we're still getting the funding. It's just in a new fund. So going forward, we have the balance, as you see in the finance report. If there's unspent funds in those funds currently, they will stay there for us to use. Just no new monies will be going to that fund. It's going to the new Health First Indiana Fund.
So anything that, any kind of ongoing things that we might have paid for out of those funds, that will be kind of absorbed under Health First. Health
Correct.
First funding.
Correct. We
Okay.
can utilize the unspent funds first. We still have to follow the guidelines from the State Department of Health. We still have to follow the parameters for the funds that are currently in place.
Mhm.
But yeah, we could definitely
Can you tell me the name of that second fund?
health,
Health-
local health services.
Thank you.
You're welcome. And then also, it's not a state grant, but the countywide lead initiative will be eliminated as of January 1st, since we will be receiving Health First Indiana funds. And those were funds that were appropriated to us from the council and the commissioners for our lead remediation efforts. So that is being absorbed into Health First Indiana.
And that doesn't necessarily mean we're spending less money on lead. It's just that it's coming from a different pot.
Correct.
Yes. Okay.
And that fund balance also stays with us, per their, attorney. Attorney Mish stated that the unspent funds in the countywide lead initiative will stay with us. Now, those unspent funds would have to be, used on lead, but the Health First Indiana funds, as long as we address a core service.
Okay.
And we also do have some, federal grants that will be eliminated. Our CDC grant, we do not anticipate a renewal process for that coming out. So we do have built into Health First Indiana, as we did in the first budget revision, those staff to stay on with us to the end of the calendar year, and then we would have them in for a full calendar year in 2025. So anything that is planned to be eliminated or expected, we have put that in Health First Indiana, just in case that funding does not continue.
Okay.
So you anticipate being able to use those same positions in different areas? Is that what you're saying? The positions
Same
that are
areas or
covered?
different areas.
Yeah,
They,
okay.
could continue the work they're doing. It's, a core service that we're offering, so it would fit under Health First Indiana.
Thank you. Any other questions for Dr. Preshutham? Report before we move into the
Environment.
spotlight?
Yep.
Okay.
I'd like to invite Mark and Brett.
Just to reiterate what I think Dr. Preshutham has said a few times is, so every month we're going to spotlight a unit, right?
Yes. And next month, it's gonna be nursing.
Nursing, okay, great.
All right. Good afternoon, everybody. Unfortunately, I believe Mark has been afflicted with a flat tire, and it was running late. But as the assistant director, I will do my best to cover. For those of you who have been on the board, you know that I can talk at length during these. Dr. Preshutham has given me an even farther reduced time frame than in years past. I will do my best to not run long. So the environmental unit is the unit in the health department that handles everything that nobody has any idea that somebody has to deal with. Whenever somebody comes into the county city building and they ask the security guard, I need blank, the security guard goes through his Rolodex and goes, 9th floor, other end of the hallway. It's going to be us. So anything from mega farms, healthy homes, air quality, such as burning, massage establishments, tattoo establishments, body piercings, vector control, property transfer, septic systems, solid waste, surface water, groundwater protection, well drilling, well protection, subdivisions, rezoning, radon, etc. That's all stuff that the environmental health unit has purview over. Rather than going through that big, long laundry list of things, we're just going to focus on a couple of things today. The two that are of most topical importance right now are going to be, first off, was going to be septic systems. We've got a lot of septic systems in St. Joe County. We have more septic systems in St. Joe County than any other county in the state of Indiana. We issued 4,706 septic permits over the past 10 years. There are counties that don't even have that many septic systems. We've got, by rough numbers, somewhere between 40 and 50,000 septic systems in St. Joe County. That's very important because we are a sole source aquifer. We are the St. Joe aquifer is the only sole source aquifer in Indiana. And for those of you who don't know what that means that there's no other reasonable way to get water if that aquifer were to become contaminated. And so it is very imperative that we make sure that we don't contaminate our aquifer. And one of the main ways that we can contaminate our aquifer is by dumping lots of sewage into our aquifer, which is what we currently do via septic systems. So all of your waste, if you're on a septic system, leaves your house, goes into a tank where it kind of settles out. And the clarified stuff goes out in your drain field, seeps into the ground. Ideally, would have a bit of a unsaturated zone underneath it where it can kind of filter out, good microbes can get there, kind of break things down before it actually gets to the water table and can get into somebody else's well. However, there was lots of haphazard development over the years. Really dense development that's not seen on septic systems that's not seen in other counties in the state. And there's just been a general reluctance to expand sewers in the county, not for our lack of trying, but those that run the sewers don't necessarily want to extend them, especially in the unincorporated areas. So this is what we got. As of the 2010 census, Harris Township alone, had 9,000 septic systems serving 30,000 people. And you can't tell me that Granger's gotten smaller since 2010. Granger itself pulls out approximately 1 billion gallons of water out of the aquifer every year. Uses, you got your normal ordinary living processes and then flushing it right back into the ground. So we're pulling out 1 billion gallons annually of clean water, and therefore putting 1 billion gallons of not so clean water back. So we have to be careful about how we manage that, so that way it does not balloon into being a problem. There have been studies done in the past that indicate high nitrates. There's lots of studies done both with the health department, USGS, lots of interested parties. I believe the county is doing another water study with some ARP dollars. We're working with county engineering to try and be involved with that to make sure that we're staying on top of things the best we can. We know that septic systems are not the only source of contamination for the aquifer, but being that we have we have tons of them, the best, if we can manage them the best we can, the better off we all are. So like I said, there's approximately 50,000 septic systems in the county. We've got 4 EHSs that are handling all of those. And 4 as of last week, we finally got one hired on so we're fully staffed with those 4 for the first time since June of 2022. It's 2 full building seasons, and 2 full main seasons of septic installations where we were short-staffed. Just a quick graph showing septic permitting. The residential new construction septics have been relatively stable over the past decade. However, you can see that we are trending upwards on septic system permits as a whole because we're getting more and more replacement systems that, systems that have just come to term. Not every septic system has a lifespan. None of them are going to last forever. And we have lots of them that were put in the 70s and 80s that they're used up. And right now we're on track for over 500 permits this year. Part of the property, a little subset of septic systems or property transfers, it's very important that we have a property transfer program. Every property that changes hands in the county has to have a septic and well inspection, or if they're not on septic or well, they have to submit documentation showing that they're not. Last year, we processed over 5,200 property transfers, of which 1,431 plus some were on well and or septic. Of those, 540 of them had some sort of deficiency. There was something amiss in over a third of the septic systems that were reviewed as part of the property transfer process. That's no good for somebody who's just plunked down lots of their money on a down payment on a home. And then all of a sudden they need a new septic system that's going to cost them just as much as that down payment, depending on the property. And this program is in place to protect the buyers. It's to make sure that the septics function the best that they can, that those who need that extra protection are protected, and ultimately to protect our groundwater. We don't want to just continue flushing our sewage into the ditch or onto the surface or letting it back up into somebody's basement. So, that process is not currently automated. It's kind of a laborious process, but with the budget for next year, we have allocated to add a new staff position that will handle property transfers as their sole focus. That'll free up staff time for permitting and other job duties. We're also going to have new software rolled out in March. Thank you. Some of you who've been on the board know that Mark and I have been asking for that at these unit spotlights for the past 3-4 years. But we're finally going to have new software that will have a public facing aspect. This would be for property transfers and for permitting. So that way everybody can see where they're at in the process. There's a public facing portal. So that way it's accountability for us to make sure that there's nothing falling through the cracks. It's also accountability for the designers and the installers, making sure that everybody's on the same page and we don't end up with a bunch of finger pointing and buck passing. We're really looking forward to having this new employee and this new software. We really strongly feel this is going to improve our efficiency and overall, it's going to be a net gain for not just the unit, but for everybody in the county. The other thing to bring to light today is our vector program. You're seeing there a dipper full of mosquito larvae and pupae. We've got a lot of mosquitoes in St. Joe County. We have one of the most robust adult surveillance programs in the state of Indiana. We've been doing significant Eastern equine encephalitis surveillance since 2021 because we are one of the few counties in the state of Indiana that do have an enhanced risk for Eastern equine encephalitis due to our regional geology. We are collaborating with the University of Notre Dame to help shoulder the burden on some of that surveillance. So that way we can better allocate our time with West Nile, as well as being on top of Triple E. Best of both worlds. It's both mutually beneficial for us. West Nile virus is endemic in the area. There have been 84 positive pools of West Nile virus in St. Joe County year to date. The prior record was 30 last year. Like I said, our surveillance is quite good. And so, I mean, that's part of the reason why our numbers are up, but when we get to the next slide, you'll see the infection rate that it's not great. We're only the fourth county in the state of Indiana to do testing at the local level. We do test for West Nile virus in-house. We also do send some to the state, but when we test in-house, that means that we can set a trap in the afternoon, collect it in the morning, sort them midday, get them tested that afternoon, find out that there's a problem, and go take care of it the following evening. 24-hour turnaround time, identifying a problem, taking care of the problem. Whereas when we send it to the state, there's at least 2 weeks worth of turnaround time. I would rather, if there's going to be a problem in my community, I'd rather be able to just address it right away. So far this year, we've tested 11,493 mosquitoes split among 261 pools. Like I said, 84 positive pools year to date. This is just showing our minimum infection rates for over the past couple of years. A minimum infection rate of 4 is the industry standard for an increased risk for human cases. Once you hit that minimum infection rate of 4, it is reasonable to expect human cases within the next 2 weeks or so. That is relatively on track, as there was a human case of West Nile in Elkhart County. None here so far, but you'll see that this is the earliest in the recent past that we've hit our infection rate. And the earlier in the season that we hit that number, that means the longer that we have the public exposed to, mosquitoes that are that infective. So,
Along the x-axis there, is that the month of the year or what is?
Oh, those are, I'm sorry, that's weeks. That's the CDC reporting week. I'm sorry, that got cut off. So we are currently in week 36 or 37. I have to double check. There's a little bit of lag because, like I said, there's a 2-week turnaround time from the state. So we do have the state's reporting 70, but we do have our ones that we've tested in-house since then. that have not yet been, the state updates every week, week and a half or so. But that's the most recent one. You'll see that we have more than everywhere else in the state right now. But mosquitoes aren't the only bug that's a problem. We also have more ticks with Lyme disease in our county than any other county in Indiana. The next closest would be Pulaski County. But we've got a lot of Lyme. Like I said, more Lyme in the ticks, more Lyme cases. We got it going on here. We also had the first locally acquired case of babesiosis in the state of Indiana in 2020. There have been recurrent cases since then, and they, to my knowledge, have not been found in any other county. The CDC is kind of backed up on tick testing. We're also quota limited on that. And as the docs can, are aware, it's very easy to not have an official case of Lyme because it's very easy just to prescribe your doxycycline and move on, then go through all that process. So as we know it's really bad, but that also means we know it's even worse. And that's the gist of it. A lot more condensed than it was in years past.
Thank you, Brett. Any questions?
Any questions from the board members? I don't have a question, but I will make just one comment that we're not putting sewage into our drinking water table. It is treated and actually the septic systems, if they're done well and installed per the health department's guidance, are very efficient and effective at treating sewage. And by the time the water moves away from the field, it's stormwater quality water. And hopefully not a threat. That's really our whole job.
Right.
With our septic program.
Right, yes, yeah. When it regulated and done properly, it's not the problem. But we are atoning for the sins of years past current.
Okay, any other comments? Thank you very much. Keep up the good work.
Thank you.
Anything else in the health officer's report? Or are we good?
We're good. Thank
All right.
you.
On the next item is new business. Item 2373, vote and discussion, the addition of a disease investigation specialist, DIS, in nursing and budgeting for that.
Yeah, before you is a request to add an additional disease investigation specialist to our nursing unit. This position has already been added to and approved for the 2024 budget. So we do have that full-time position starting in 2024. However, the communicable disease cases are so large that the current staff we have, which is one public health nurse, we do need an additional disease investigation specialist to start sooner rather than later. So if we're able to onboard them yet this year, this is what this budget takes into account, because as you noticed, the amount that we are requesting to appropriate isn't a full year salary. The council just wants to know what dollar amount would be needed for the rest of this calendar year. That's how we came up with that dollar amount listed there.
And that's the 16,388.
Right, depending on when they start, because we have to go through the process. It has to go to the council. So there's going to be a month and a half yet before we can post it and then, do interviews. So that's on the high end. That is the most that would be needed to onboard that person this year. And the funds would be coming from our fund balance.
Any questions from the board? Comments? Not, I'll entertain a motion.
I move to approve the addition of a disease investigation specialist in the budget.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, 2374, discussion and vote on maternal and infant health coordinator, Hope, budget and updated job description.
This one we had recently discussed at a previous Board of Health meeting as a updated job description. However, we have since found out that we have not been selected for the next round of grant funding from the State Department of Health. So we are interested in moving that part-time position to a full-time position and starting them this calendar year using our health crisis COAG funds. And then as of January 1st, they would be moved to Health First Indiana. So just another position that we would like to, we've been without that position for a few months now, so we would like to get someone onboarded before Health First Indiana starts. That way it's a smooth transition right into Health First Indiana.
Quick question. I did not see this position listed on the website.
It can't be yet. We have to go through this process. We have to
Okay.
have the board approve it and the council approve it before we can post it. We cannot post it until it goes through the full cycle.
Okay.
That is true.
I have it.
Correct. Once we found out that we were not going to receive the next year of grant funding, we didn't post for the position because we weren't sure what our plans were. Now that we know that we want to, turn that position into full-time and get them started and then transition them to Health First Indiana, we wanted to get that process started now. But yeah, we can't post until it goes through the full cycle.
Any other questions? Comments?
I move to accept the maternal health infant health coordinator budget and job description.
We have a motion. Do we have a second?
I'll second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, 2375, vote, discussion and vote on the St. Joe County Health Department personnel policy change, section 800, resignation, retirement, and terminations.
And I have an amendment. So before you is going to be different than what I'm going to read here shortly. But what we are wanting to do is we have had two of our most recent resignations gave us less than 24 hours notice when they were leaving. So we wanted to put language in our personnel policy to require at least 3 working days notice. So the updated language is employees voluntarily leaving the Department of Health must give at least 3 working days notice. The department head shall determine whether the employee may work out his or her notice. If an employee does not provide advance notice as required, the employee will be considered ineligible for rehire.
Any questions or comments on that?
Could you read that one more time?
Certainly. Employees voluntarily leaving the Department of Health must give at least 3 working days notice. The department head shall determine whether the employee may work out his or her notice. If an employee does not provide advance notice as required, the employee will be considered ineligible for rehire.
So that second sentence, you said, the department head, that may work out his or her notice. I'm trying to hear the exact language.
The department head shall determine whether the employee may work out his or her notice. And that language, actually, we just piggybacked off of what St. Joe County has in their policy.
Okay.
We determined the 3 working days for our department. The rest of the verbiage comes from the county policy. Would it be easier for you to see it?
That's always helpful, sure. But, and I can pass it down in case people are more visual. Yeah.
And I think we've
But-
experienced a couple of resignations that were like, they just said, I'm leaving and with no notice, right? Or no
Yeah.
warning.
Yeah.
I think this is just to address the abrupt resignations. We've just had initially when I started resignations that gave us less than 24 working hours. Sometimes it was at the end of the day, this is my last day, and it makes it difficult for the organization to make sure that we are fulfilling our requirements and are able to capture the workload that's going to be missed when we're given less than even a 24-hour working day notice.
So it's giving the department head discretion to decide whether if that person gives notice, whether they can leave immediately without repercussions
Yes.
or not.
Mhm.
That's what when I was just listening, I wanted to make sure that I was understanding it correctly.
Yeah, because we recognize sometimes there are circumstances beyond our control and we can't work the extra time.
Mhm.
But we would appreciate if we could get the 3 days
Mhm.
and then deal with special situations on a case-by-case basis.
Any further discussions or comments? Hearing none, I'll entertain a motion.
I'll move to amend the section as specified in the written statement.
We have a motion. Do we have a second?
Second.
We have a motion and a second. Any further discussion? All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item, 2376, discussion and vote on a 2024 fee schedule for food services, sorry.
And going forward, we are going to try to limit these to one letter per unit instead of having them individually. But for our foods unit, and both of these with the foods unit as well as vital records, we're asking for these to become effective January 1st of 2024. But the food unit schedule fee increases are fees that we are currently charging within our department. They're just requesting an increase due to the extra hours that our staff are working, like for the temporary events, especially the increased hours of our staff and the weekends that they have to work. Regarding the increase for the annual permit fee, we're only asking to increase the first fee, the $375, which is the lowest fee that can be charged for an annual permit, to increase that $25 for $400. I'm actually not sure the last time we did fee increases for the foods unit, but it's been a few years, so we haven't done any increases in quite a few years. An increase for our lost or stolen permit fee going from $5 up to $10. And that is all the fee increases for the foods unit.
Any discussion or I'll entertain a motion to approve.
I just have a quick question. So when you said you're going from 50 to 65, that's dollars an hour, correct?
No, that's not per hour. No,
Oh,
this isn't for the employee. This is for
Okay.
the permit. So it's just a flat, instead of the establishment paying $50 for the permit, excuse me, they'll be paying 65.
So do you anticipate that that extra $15 will cover the work hours that people are putting in? Is that
Over
what
the
you're
amount
saying?
of establishments, yes.
Okay, and and I'm not familiar with, are we paying our staff salary or are they hourly?
Our non-exempt staff are considered hourly. However, they are paid a salary, and anything above the 37 and a half hours physically worked, they get comp time for. So they're not paid anything additional. It's comp time or straight time.
Okay, no
Yeah.
overtime.
No.
Any further discussion? If not, I'll entertain a motion.
I'll move to accept the fee schedules as described.
We have a motion. Do we have a second?
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you. Next item on the agenda, 2377. Discussion and vote on the 2024 fee schedule for vital records.
And for the vital records unit, for 9 out of the 10 is a slight increase in fees, so we can remain in line with neighboring counties for the services that we offer, and of course, the increase inflation for the supplies that we have to purchase to provide the birth and death certificates. The last item on here would be a new fee. It is a home birth registration fee. That is something we have not charged in the past in our unit. So that would be a new fee and we are requesting it to be $50.
Any questions on that? Does that?
What is the $50 home birth registration fee cover?
That's a great question. I'm sorry, Erica. I
Like
told her
that.
she wouldn't have to.
Last time they come in and meet, if there is no advice involved, and so we're having to make phone calls back and forth, moms, who's coming in, records, et cetera. So there is and recently, I didn't even realize where you came up that type of fee until I was doing comparisons for the best records, and I realized other large county have one already in place, so that $50 is the same as that county. But there is just more work involved, and then not only at our level, we have to put it in, but also at the state level. So we're doing it twice, we're registering the work twice, and then there's just a lot of man hours going into that.
Thank you. Any further discussion or questions or comments? Hearing none, all those in favor say aye.
Aye.
Did we make a motion yet?
No. I move to accept the increases in the fees as noted in the vital records.
Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Dr. Helenthal's here. He's making me nervous. He's my idol. Next item on the agenda, grant requests. We have none. Under old business, we have item 2366, discussion and vote, County Code 51, sewage and septic system regulations as amended.
I'd like to invite Brett to come up and kind of highlight some of the changes that have been made after discussion and review of the public comment, working with some of the board members and our attorney to make sure that this ordinance was compliant and fair.
Hello again. Also with me is Dr. Ron Hellenthal. You recently reappointed him to the advisory board. He is the chair of the Onsite Wastewater Advisory Board and has a wealth of knowledge about everything, far more than I do. Like I said, he is the chair of the advisory board, PhD, and director of the Biodiversity Library at Notre Dame, and pesticide review board, and a ton of other stuff. I don't, you can talk about yourself if you want, but but he's also here to help answer any questions if you have any regarding the process and what the advisory board did to get to where we're at today. This draft has been amended since you reviewed it last month. We did have multiple meetings, including a public input session. We listened to all of those comments as well as reviews from attorneys, and the draft that you have before you now has been vetted by the attorneys, and we are confident that it is a nice and appropriate ordinance for St. Joseph County.
Did you want to step through the meetings that you've had to discuss the changes or any of the changes specifically? We've had a couple of major ones that I can think of, but just in particular, the reserve area, I think, was fairly significant.
Yep, so there was some language that in this ordinance that was softened to be more congruent with what the new Indiana statutes are. There was multiple sections where requires were softened to requested or suggested, things along those lines. We felt it was appropriate to keep those sections in there, even if they weren't requirements, because it shows that we, do still have a vested interest in those aspects, but also acknowledging that, we need to operate within the bounds of the state statutes. So the reserve area is one of those sections where It is recommended that you have one and it meets these requirements. However, in the event that that is not feasible, we are not going to deny your site.
Any questions, comments? I have a few minor ones. Thank you for all your hard work on this. I've been peppering Brett with all kinds of comments and ideas over the last few weeks, but under definitions on page 6, operational status report, which is a report that we have to do or that you want to see for a repair or replacement. It just says in there established procedures established by the health department. And that's very vague. I was just wondering, can you tell us, you know, is that something written that is reviewed and approved either by the health officer or the board or the, it's not just the whim of.
No, it is not just the whim of whoever. It is it would be my recommendation, especially being as a on-site wastewater advisory board member, that be taken up by the on-site wastewater advisory board. The need for a operational status report is required under Rule 410 to utilize best judgment. It's one of the criteria for utilizing best judgment. That's not something that the health department has largely done. But again, trying to be more in line with statutes, you know, having that in there, the language as written would provide the mechanism for the advisory board to take that matter up and then issue some sort of policy. I would equate it similar to how the Water Resource Advisory Board has a policy and procedure for property transfers.
Great. And then this is getting a little deep, thicky, but on repairs, again, in the first sentence, it says, I'm on page 7. It just says that you can't do any repairs of the septic system in the absorption area. And then in the next sentence, we talk about air injection of the soil, which I presume would be in the absorption area. So just if we could reconcile those two issues.
I think the elimination of the words other than the absorption area would probably rectify that. Striking that, I don't think, changes the intent of that definition. I know the definition of repair, as Dr. Hellenthal and the other members of the advisory board that are here, that was a long topic of discussion.
I believe it. Next item, my third item is on page 10, at the top there, item D. I'm always on the lookout for things that are really vague that leave the public, kind of at risk. But any other dry well when deemed reasonable and necessary by the health department. That seems very all encompassing. Can you tell us more about, how the health department goes about determining if it's reasonable and necessary, and also maybe should that be something at least the health officer does versus the department? Oh, sure.
Before, John, I think because we have we have three different drafts going on right
Okay.
there. Maybe if people could mention the section and the section that we're under too,
Sure.
but Michelle just pointed it out to me, but you said it's section 5, 51.07
B4.
B4D.
For
Okay.
D.
Yeah.
So B4D, yeah. So I don't know. Again, it seems very broad and all in.
It is a bit broad. If it were up to the State Department of Health, we would not allow any dry wells, period, and everything that would be in existence currently would be automatically deemed a failure, and we need to address it immediately. That is not extremely feasible. That the language there, when deemed reasonable and necessary, was kind of an attempt to bridge that gap. The main intent of that was some of the medium-sized ones, as stated under Section A, the federal regulations for ones that serve 20 people or more. that section was for some of the medium-sized dry wells. In the discussion during the advisory board, the medium-sized ones, some of the office building kind of ones, the commercial ones, that's where it that was the intent of those, of that clause, while also having language in there that we thought would be able to appease the State Department of Health, that we aren't, we're not, trying to be super soft on dry wells, but still addressing them. I will point out that, your comment about the health officer rather than the health department, I think, if we wanted to go that route, we could. There is the mechanism for an appeal of the directive of the health department within 51.50G. I think somebody taking issue with us removing the dry well under that clause, I think that would be an appropriate avenue for them as some sort of recourse.
Okay, we just got two more easy ones. Okay. 51.31, which is roughly around page 28. There's 51.31. Item A4. Again, this is just, it talks about the health department may recommend against the use of specific supplier equipment or materials for the use of septic systems when the health department determines the equipment or materials to be defective or not suited for the conditions in St. Joe County. So my question there is, how in the world do you go about figuring out what's, obviously defective or not suited well, and what's an example of that?
So one of the examples, I think the one I used at the last meeting where there was the requirement for a setback for sprinkler systems. Something like that. I think it's something that we locally know that this area, or maybe there's even maybe there's an HOA covenant that requires irrigated lawns or something like that. So putting in a type of system that would require sprinklers to be set back by X amount of feet from that system might meet statutes and everything, and so we would approve it. But we could recommend, you sure you want to do this? Is there anything else that we can do? Because we know the reality of the situation that there's probably going to be sprinklers in this that could lead to a premature failure. So that would be my first example that I could think of where it's just more of a societal condition, not necessarily when talking about the conditions in the county.
Okay.
John, if I have some of the same kind of points that you have. Do you want me to wait to talk about those, or do you want me to interject on piggyback on what you're saying for each spot?
That's up to you. I've only got one more, so
Okay.
maybe I'll just finish
Okay.
this and then you can go. This is a really easy one. On 51.35, you list that they have to install a septic holding. Oh, I'm sorry. It's around page 41, section 51.35.
0.35?
Again, this is kind of picky, but you go on to say, or the ordinance says, shall install a holding tank, abandon the property, or put in a septic system, but they could also connect to sewer as an option. So just, there are maybe some other options there that.
Or you want to add something? Or to add or to connect.
Or connect to sewer,
Okay.
that would be, I suggested.
I mean, if we want to be that precise, adding in, install a holding tank, connect to a cluster, connect to a sanitary sewer system, or abandon the property. I think that's not a substantive change.
Yeah. All I have. Okay. I'm just informed we have to vacate the room by 5:55, so. Hopefully we can get through business, and if not, we'll have the table. So, any other board member have questions or please?
Okay, I'll try to go fast. On page 9, the 51.07, the prohibitions. It says that it's under B, number 4B, and it's any dry well without a permit on file with the health department. Do all the old systems have a permit on file?
We have records going back to 1970.
Okay, so in this, that doesn't constitute that they would have to redo the well. Like, for instance, if you sell a house and they don't have a permit on file, but they have a dry well, what does that mean?
That would mean that under this ordinance, you would be required to upgrade your septic system.
Okay, that's what I thought. Even though it's working.
Working for sewage disposal and working for sewage treatment are different things. And this was a topic of discussion at the advisory board, and it was determined that if it is that old, 1970 or older, I mean, the fact that it is not, dry wells have been proven to be point sources of contamination. That's a good baseline start for requiring them to be upgraded.
Okay, I have like specific, like my parents' house is that old, it works fine. They're older, if they die, I'm gonna have to put a whole new septic in. Even though their groundwater's good and all the tests, there's no way to test around that, that's what I'm saying.
There is.
Yeah.
So just to answer your question, so the state, the federal government, everybody who studied this understands that dry wells are not effective in breaking down sewer. That's the reason why they're discouraged. Old dry wells are particularly ineffective and basically contaminate the groundwater. So everything that can be done within reason to discourage those really needs to be done in order to protect your neighbor, the resource that we depend on. So the point is if it's that old and it's never been registered, when the property changes hands, that's probably the best time to try to fix the problem. And that's what the ordinance is trying to do.
Can I ask a related question? I just wondered how many homes in St. Joe County realistically would have this as an issue? Is this a lot of homes or is this just a very increasingly small number?
I mean, it's increasingly small. As you saw from the presentation, we're getting more and more replacement system permits per year as it is. A lot of them are being rectified anyway. There's not a ton of systems. I mean, in the grand scale of the 50,000 that we have, the ones that are unpermitted were probably 10% or less.
So like 5,000.
I mean, potentially, and I mean, not all 5,000 of those are going to be dry wells, and record keeping is, especially when we're going back to record keeping the 1970s up till now, those numbers are very kind of off the cuff with the best math that we could come up with.
I also had the exact same question. I'm not gonna go it again, that I thought it was vague about anything that was deemed reasonable and necessary by the health department. There's actually about 30 plus statements in this entire document that are very vague, like can do if necessary, may deem if required. I don't like that language. I feel like it's allows for subjective bias and prejudice, and it should be more clear. Not so many of those statements. Then that was one of them I had marked. And then under 51.15, page 12 on 8, section 1, it says that the septic system installers, are they licensed by the state already or no?
No, they are not. And I did have a discussion with the Indiana Onsite Wastewater Professional Association about this. And it is the goal of the industry that the state will end up being a licensing body. However, the IOPA, as it currently stands, is just a somewhat regular testing entity. It's a professional trade association that you pay dues for, and they offer a test over the basics. And if you pass the test, you either have to do CEUs or retest in 3 years to prove that you still know what you're talking about. But there's no actual license statewide license.
So St. Joe County is doing the same thing they're doing. But we're also requiring a license, correct? Like,
So-
I know you took out I think, unless I'm reading this wrong, you took out the licensing requirement for the soil scientists. They just have to be in good standing with their board, or whatever.
Yeah. So the soil scientists, it's,
The state licenses soil scientists, they actually, they're
Yeah,
licensed through the
yeah,
state.
I know they do,
Yeah.
but we used to have that in this and we don't anymore.
yeah,
correct?
we changed the language from like being a registration to it being a list that we can provide to the public. We want you to be in good standing, so that way we're not telling somebody to go use this person that they
Another
can't actually
licensee,
use.
Yeah. But
Um,
but you're saying that they aren't licensed, so that was my question. I just wondered if we were double licensing, but you're saying no.
no, there is no license, there is no state license for septic system or septic installers.
And then this we had a question about so it's page 13 and it's under still the 5115 and it is 31B, number 3. Any person who conducts a septic installation inspection for compliance with the property transfer, we were just talking about that a little bit. Did the state ordinance remove or not that it was required to have a septic inspection for transfer of property?
No, they did not, not for us.
Because of,
There's two sections of the statute. The first section of the statute says that if it's an ordinance for a city, town, or county, then it's void or voidable. The second part of the ordinance says that if it is a rule or regulation by a local health department, which is ours, then they cannot put it in place after July 1st of 2023. Ours has been in place for over 20 years, so it is still valid under the state law.
so even though it's already, this is just redundant then, because this statement of what it says where you have to have a license to inspection, all that, we already have that going on.
Correct.
So some of this that is in this is already redundant.
Yes.
Okay. And let's see. There's another section that just has some of that any other system. It's 51.16 under permits, page 17, number 3C. It says any other system determined by the health officer to require operating permit. It's just more generalized. Like, it's kind of like throw the kitchen sink in and make sure that it's covered for anything else. Again, I don't like the language. And then same thing with C, it says, but not limited to, meaning like, here's all these things, but we can also require other things. I feel like that allows for more subjective interpretation. And then it says under number 3 of that same section on page 18, the health department may refuse to accept drawings from any person identified who repeatedly does, and it lists 3 things. Is that like forever or what? Like that says can refuse to accept drawings. Is there like a probationary time? Should there be one in there? That's also kind of gray, like, hey, we're never looking at your drawings again. It seems like it should say for 6 months, for a year, whatever.
I can't speak to this section because since I've been here, we've not actually told somebody that we're not looking at their designs. We've come close a couple times because after the 9th revision, because they don't have the same thing we asked for the first time, it gets frustrating. But in other instances where somebody was basically suspended, it's been at the health officer's discretion. There's a hearing, it's, this would be addressed via, I would presume, via some sort of order of abatement or something like that. So that way there is the mechanism where there can be a meeting where it can be discussed how long that probation or.
So maybe we should just throw that language in there, to clarify, like there is going to be a trial or something where you can discuss that. And then, let's see. Oh, and then this, so you were talking about the set aside section, which is great. But then on number 4, it says that any application for septic permit for new construction, so location of the proposed septic system and the set aside area. And it lists the following requirements, but then it says that they won't deny it. So those seem conflicting.
We left it in there saying, having reserve area is something that the county feels strongly about and has wanted for a long time. And so leaving that in there and saying the base standard is you should have this. However, we acknowledge that state statute, per statute, we have to accept it. But we do strongly feel that it should be accounted for. And so when accounting for it, these are the requirements that we'd like you to account, when you're accounting for it. Don't just draw a box on a piece of paper and throw it at the corner of the lot. It ought to be legitimate.
It just seems conflicting, that's all. And then the same on A, it says the set aside area should be assumed to be the same size and type as the first system unless otherwise specified by the health department. It seems like that is something that should be as determined by the soil scientist and designer versus the health department, meaning they're designing the first system, correct? So if you've got, because you know how the soil is around here, it's different from one foot to the next.
Right.
So if you've got, here's your original design or your septic area and your second design is over here, but it's a completely different system, like it has to be. Wouldn't that be something that the soil scientists and the design would do instead of the health department? Like why is the health department involved in the septic design? Why are they involved in that portion of it, I guess?
It would be in tandem. Not every soil scientist does designs. They'll just go poke some holes and submit the report. The bulk of,
The designer, the septic designer does it.
Yeah, the soil scientist might go and poke some holes and we'll get that report and then we don't interact with that soil scientist again on the lot. There's a couple soil scientists where that's very common.
Yeah.
And so you're right, if it is very different, then we can, like, if the primary is gonna be, for some reason, the primary is gonna be a mound, but the reserve areas doesn't have to be a mound, we can say, that's fine. We're not gonna, and vice versa. I would say that is in line with our normal design review procedures.
So shouldn't it say there though, as specified by the septic designer instead of the health department? Like, I didn't realize we were doing septic design. Like, as the health department, we're not doing that, correct?
We are not designing the nuts and bolts of the system, no.
Yeah, so I feel like it should be specified there, changed, so it says that. Not that the health department's doing it, but the people that are legally responsible for the system design, they are the ones that are having to design it and say, and show it to you. This is this one, this is this one.
But not every site has a soil scientist doing the design. I would say.
Or a septic designer, though, one of those two,
But not-
or
not-
both.
I would say the bulk of our septic designs that we get come from installers. We'll get the soil report in and then it's totally on the septic installer to do to draw up something. So not necessarily a professional designer or a soil scientist.
Do you feel like the installers aren't qualified to do it then, though? Is that why we have the health department listed as the person or the entity that would do that?
Some don't want to even look at a soil report. They just want to submit it to us. We tell them what needs to be and they move on. And so we have to account for that.
Would replacing the word specified with allowed, make more sense to you? I mean, I get what you're getting at.
Well, I mean, I can see like if you want it to be reviewed, but it doesn't seem like that's their job. Like their job is the health department meeting, like I wouldn't think you'd want to take on that liability either. We don't want it to be like something that the health department is designing this system and then telling the installer how to do it, because that puts a liability on the health department for the design if it fails. We don't want any liability. And I know at the back here, it says there's no liability, but there kind of is if you're designing the system. So it seems like it should say something different than the actual health department is designing it, but I'll let y'all think, stew on that for a second. So, let's see. Oh, and then I just asked about which you already did, about why do we have like two conflicting statements with the requirement for the reserve and also saying the reserve, we already talked about that. And then on page 20, like the very next page, it's talking about the operating permits, and it lists like 51.3A and 51.34. Is that in this document, the 51, or is that a separate thing? Is it saying refer to those sections? Is that what that means? Yes, okay. And then where is G? Because on the next page, it says issue minimum specifications for design of the septic system. And it lists all these different requirements, and it says see the above, which is section G, but I don't see a section G. All right. Where's it at? Oh, you mean which section it's under?
Oh, yeah.
It is, oh, geez, I gotta go back here. It is 51.16 under permits still.
So it just, I think it just didn't get corrected. It should be E.
Oh, okay,
If you
okay.
look on page 20, G was changed to E. And so I think that
That's
there's
a
could have just been.
effect-
So it should
typo.
say E,
Yeah,
not
E,
G.
not G.
Yeah,
Okay, because I was like,
'Cause-
where's G?
because G got changed to E.
Okay, okay. That makes sense. Okay.
Yeah.
And then in the part 1, after all the pink, do you guys have pink on yours?
Yes.
It says, if an operating permit is determined to be required by the health department and it lists pursuant to the requirements for operating permit should be made on a case-by-case basis. And then it says shall include all the requirements necessary, for the operating system, and it lists a bunch of stuff. What does that mean, case-by-case basis?
I mean, we don't want residences on the same strict regiment as like a McDonald's. I mean, we've had McDonald's on septic systems before, and that's a mess. And so it'd be silly to have a home on those same requirements. I mean, if you're having an operating permit, that means something is atypical as it is. And so we want to tailor it to make sure that it has its best chance at success.
And it says again, is that what you're talking about, where it says requirements for their operating permit shall be specified by the health department, and then it lists all the other things? Is that what you mean by that, where it's like, it applies to all systems? Cause it just says non-cluster systems.
Oh, okay.
Is that what that means?
Yeah, I'm looking at a stripped down version of what yours is, so I'm trying to catch up to where
Okay.
you're at.
It's on 20, but page 20, you probably have a different page.
I might have I have the most recent,
Yep.
why don't you show me on here? Or is it?
Non-cluster.
John.
setup. Yes.
It would be-
As it is all like 6:50, I hate to like interrupt, but it seems like maybe we should move upstairs. Since it seems like we're probably gonna take past 6:55. So I
Is that the wish?
was thinking perhaps I would move that way.
Yeah, I have a lot.
if you're okay with it.
Board, move upstairs and can we?
I would like to make a motion that we take a 5-minute recess to move upstairs to the upstairs boardroom so that we can continue and give this the time it deserves.
Second.
Well, motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed, same sign. Meet you on the 8th floor conference room in 5 minutes.